long waiting list. As you can imagine, we're quite an in-demand service because we are so unique. And from that reason, when children are referred to us, their families are already really in I suppose, a time of crisis. And then by the time they actually get to us after being on the waiting list, families are often past themselves. So you can imagine that they are very difficult, going through very difficult times, and it can be very stressful for the families and very stressful for the staff. Progress can often be slow. And morale within the team can often be low. So we thought we could address some of those issues within the team. So I suppose just a bit of background of where we work out of. So this is our building here, Cedarwood, which is in St Luke's in Armagh. So we share this building along with other paediatric teams. We have the paediatric eating disorder team, the ADHD team, the substance use, infant CAMHS and occupational therapy. So we all live very happily in this little building in Armagh. So why Joy at Work? So it was already said, with being such a unique team, it can often be difficult. There's no prior training. You can bring your skills, of course, from the post you were in before and your professional background, but the work is very different, and no 2 days are the same. So morale can often be low within the team, and we wanted to address that, which we thought that in turn it would also improve productivity. It would improve the quality of care provided to our children in the service, improve working relationships with each other, and promote health and well-being within the team. So the very beginning, so I suppose really we started back in Christmas time in 2018. It was coming up to Christmas time, people were busy, their caseloads were busy, it was dark nights, and morale was a bit low at that time. So Claire and I were the only senior members of the team here at that time. So we thought that we would try and boost morale a little bit around Christmas. So we sent an email around to the team saying that we were going to undertake training and for everyone to be in our training room at a certain time. But in actual fact, we had brought in like party snacks, and we had Christmas music, and we'd done a few Christmas games, and Claire and I had devised a Christmas video of all the achievements that the team had achieved throughout the year. So we went through month by month, January, February, March, and we acknowledged both professional and personal achievements that the team had achieved. And it was interesting actually showing the video to see the response from the team, because although people were a bit deflated and morale was low, actually whenever we seen on the screen ourselves what actually we had achieved, it did boost morale, and people acknowledged, you know, actually we have achieved quite a lot. So it was interesting, and I think that was really where our Joy at Work journey really began. So then in March time we went, we were lucky enough to go to Glasgow to the IHI conference, and we were there actually presenting posters of different QI projects that we had been involved in. We love a bit of QI in IHI CAMHS Team. So we were there presenting, and we went along with the quality improvement team, and it was the first time really that we had actually been able to meet them, and they were great support. And I have to say, throughout our entire journey of Joy at Work, the quality improvement team have been fabulous. They're always at the end of the phone, and they're always there to guide and support us, and to have that support has been fabulous. So it was great to meet them when we were in Glasgow, and it was great to see the great work that was been done, not just in our own trust, but globally. There were teams from all over the world there presenting. And a lot of teams were presenting about service users and making the journey better for them and making the experience more efficient, which is fabulous. But there was also a team presenting about Joy at Work, and that really resonated with us. We felt that was definitely something that we had been interested in, and interesting to see that other teams had acknowledged and were doing work around that. So we came home from Glasgow. We were extremely inspired by all this work, and we thought we could definitely bring that back to our team and take it forward. So next then, I suppose we got together and we started to come up with ideas. We started to organise group activities that we could do as a team to boost morale. And we contacted the QI team for advice and support. Now I have to say, before that, we came back with these ideas and we started to organise events. In hindsight, looking back, we didn't really, I suppose, think of it as a QI project. We jumped straight into doing the activities straight away, and then we decided to make it a more structured approach, and then done questionnaires on down the line. But initially we started to organise activities. So around that time, the chief executive, who was newly appointed to our trust, came to visit our team to learn about our work and about what we were doing as a team, and about our children and our cases. And it was in, we had an American diner theme lunch for him, which he loved, and which was great, and the whole team came together to organise that. And one of the interesting things that the chief executive had said when he learned about the work that we were doing with our children, and he asked how did we look after our own mental health, because he acknowledged that it was quite an intense job at times. So from that visit, he allowed us then to have 30 minutes a week to address our own mental health. So within the team then, we decided that we would go on a wellbeing walk, which we do on a Thursday. So we have been doing that now over a year. So every Thursday at lunchtime, the entire building, or whoever is available, will take part in the wellbeing walk, and it doesn't actually take 30 minutes, it's maybe 15. And I have to say, this is the grounds where we are based, and we're very lucky to have such beautiful grounds to be able to enjoy doing the walk. So the wellbeing walk is still ongoing. So then it was International Nurses Day, which again, as a building, ID CAMHS had invited people along to our staff room at lunchtime, just to celebrate International Nurses Day. So we got our packs from the RCN, and as you can see, we brought all our healthy food in to celebrate. And again, it was something small. It only took half an hour at lunchtime, but it was something again to bring the building together and to bring teams together. So then we, I have to say, Alana and Karen were instrumental in organising our sports day. So again, an email was sent into the entire building, whoever wanted to take part, and we had a great uptake. So the sports day was August time.
August, yeah.
And it was a half day. It was a half day event, and we had different activities in it. It was absolutely fabulous. And we were all separated into different teams, with the blue team, the purple team, the pink team, and we all got little prizes, with certificates and all. It was absolutely fantastic. Everyone really enjoyed it, and it definitely boosted morale, not only for our team but for the entire building. So then also around that time, the community paediatric team had invited us, ID CAMHS, to compete in a volleyball match against them. So we gladly accepted. As you can see, we took it very seriously. We had our t-shirts made. We practiced at lunchtime. How we won, I still don't really know, but we did win, which was great and great fun. So as a result of us winning now, we have to organise it this year. So watch this space to see what we'll come up with. But again, it was great to engage with other teams that professionally we engage with outside of work. So all this took place outside of work, and it was great to be able to connect with those teams. So I'll hand you over to Alana now, who is going to talk you through our driver diagram.
Okay, so as Kate has already said, then coming home then from Glasgow and coming home from the concert, or the conference, sorry, on the Joy at Work, we were very inspired and we jumped straight in. We just wanted to boost staff morale straight away, and we went through all of the activities. But I suppose we did want to make this into a QA project, and in hindsight, we probably should have done that before we started all of the activities. But I suppose for us then, our overall goal was that we wanted to improve staff morale within our team, within the ID CAMHS team. And we had two very key aims. So the first aim was we wanted to increase staff morale within ID CAMHS, and the second aim was we wanted to sustain improvements using the IHI Joy at Work framework. So then from the first key aim, so increasing staff morale, we had the objectives. So we carried out a baseline survey of staff experience, what matters to you conversations. We wanted to identify pebbles in our shoes and boulders. And then with the second aim, I suppose it's still quite in the early stages, but we wanted to initiate specific and meaningful activities within our team, and I suppose in the measurement of it, we want to do ongoing measurement, and I know that we jumped straight in, but we do want to gather that data, so we're going to continue to do that as a team. We wanted to communicate our findings because I suppose that's important. We want to share our learning, and we've had a great opportunity today to be able to do that. So our initial questionnaires then, so these were circulated to our team. So there was 14 members in the team at the time, and the questions were taken from the IHI Improvement Self-Assessment. So we looked at what matters in your job, we looked at what does a good day at work look like for you, and we wanted team members to give examples of pebbles and boulders within their work environment at the minute. So we grouped them and we themed them together. We had a lot of different responses, and we'll have to acknowledge that our team was very honest in their responses, and we're very grateful for that because we got great feedback. So what matters to you then? Some of the things that were coming out was good working relationships within the team, fairness and equality and respect, autonomy within the team, organisation and sufficient time, good leadership, trust, job satisfaction, and recognition and appreciation. Similar things were kind of coming through, and what does a good day at work look like for you? So people were saying being able to complete tasks that were on their to-do list, feeling that you've accomplished something that day, having training and learning new skills, having the time, I suppose, to complete them tasks. Time was a big thing that came up, and I suppose that's going to be the same in any job environment, having the time to do things, the support and the teamwork, and having good working relationships with external agencies and teams. And some people had said, ensuring a good start to your day was very pivotal in what a good day at work looks like for them. So we use the analogy of pebbles in our shoes and boulders. So to give you a bit of background, so pebbles are these small, annoying things during our day. They can be overcome by simply addressing them and tipping them out of your shoe. There's smaller day-to-day issues that we tend to face in the workplace, but can have an impact on our working day. And you are able to live with one or two of them initially, but we don't want them to grow. So some of the examples, then again, we themed them into categories, and some of the things that were coming out was time and resources, staff morale, negativity within the team, individuals' role and remit, development within the team, fairness and equality, and self-worth. So these were some of the examples that people had gave, just to give you a bit of background. So there's things like negativity within the team in terms of the focus during team meetings. People had said about having honesty and openness, having no work chat at break, lunches and social events. So trying to keep that separate. And some people were saying, feeling that work isn't completed to a high enough standard. So there was lots going on, and again, people were very honest in their responses. Then in terms of the boulders, so these are the major obstacles. These are things that we have no choice to work around because we can't move them or we can't change them very easily. And they're major stresses that have a significant impact then in our joy at work. So I suppose for the team, for some people, pebbles were boulders and vice versa, boulders were pebbles. So it's good to acknowledge that. And again, the same things were very similar. So time and resources, leadership and management, system and efficiency, fairness and equality, development and negativity. And again, some of the examples were things like flexible working hours, delay in IT resources, lack of induction process. And some of these things we can change. So I suppose following on from that, then after getting the feedback from the team, we decided to implement a few more joy at work activities, and Karen, I'll tell you a bit about them.
So part of my role, or part of the joy at work, I suppose, was that they were able to appoint myself as a health champion, and that was through the Promoting Wellbeing team within the Southern Trust. And they have a great emphasis on having a health and wellbeing champion in as many departments as they can to help encourage their work colleagues to promote their own mental health and look after each other. So what we did then, Claire within the team is actually a member of a local running group, so she came up with the idea of trying to get as many people within the team to do a Couch to 5k. So that started in August time, and Claire took charge of training everybody after work and building people up so that they could complete their first Couch to 5k. And there was a good few members took that up, but some actually had to drop out because of injury, and I myself was one of them. But they very successfully then completed the Couch to 5k just a matter of, I think it was 4 weeks later, so they done really, really well, and hopefully now this year they're going to try and do another one as well. So alongside the run group then, coming up to Christmas time, of course, as Kate said, at that time of the year, it's all dark nights, morale can be a wee bit low, so we decided then to do a little black dress challenge, what was just every week having a weigh-in and blood pressure checks for as many people in the team who wanted to take part. And there was actually a couple of girls in the team who were pregnant at the time, so they availed of the blood pressure checks as well, just to kind of keep themselves, just to keep them well, so we had weekly weigh-ins, and I composed this wee chart for weigh-in and blood pressure, and then we all celebrated at Christmas time then whenever we had successfully fit it into the little black dresses.
We put all the weight back on.
So then in October time, to mark World Mental Health Day, along with the Mental Health Foundation, they were promoting having a tea and talk. So we thought this was fitting, as we are a mental health department, to take this up, and it just was very simply at lunchtime one day we had buns and treats, but information as well on how to look after your mental health, stress, how to cope with stress, and promoting all the different wellbeing activities as well that run within the trust. So now at the minute then we are trying to do the Daily Mile. There's been 12 staff out of the 16 have taken that up. Now not every day, it doesn't suit everybody every day with clinical appointments, but we are committed to doing the 60 miles. So however long it takes, we're going to make sure that everybody gets their 60 miles and completes their Daily Mile task. So Kate, I think, is now going to take you on and what's going to happen, what's happening now.
So as I said, we jumped straight in and we done a load of those activities. So now then we, with help from the KI team, we started to come up with change ideas of what we could do to address some of the pebbles and some of the boulders within the team, because Alana had said for some a pebble is a boulder, and for others a boulder is a pebble, although a lot of the things were similar throughout. So we actually presented our findings of the questionnaire to our team last week, and I have to say maybe a bit of tumbleweed initially, but they were very accepting, and I have to say management were very good at and keen to address some of the issues within the team. Our team was extremely honest, and as Alana said, we were very grateful for that. And with it being such a small team, I think it's actually important, and we did acknowledge to the team that although some of the things may be difficult for others to hear, there was no blame in anybody. It was kept very generic, and we didn't want anyone to feel that it was one person's fault. That was something that we were very clear about, but we did address the importance that we were actually acknowledging that morale in the team can be low, and it does impact on our kids in our service. When they get to know a member of staff, that member of staff becomes involved with their family. If that member of staff leaves, and turnover in our team had been high at a time, when that member of staff leaves, it involves then another new member of staff coming in, being trained up, becoming confident, meeting those families, and if that member of staff leaves, it's a rolling effect for that family. So that was really one of the things that we were keen to address with keeping morale within our team high. So at the minute we are currently looking at our change ideas, and as I said, we had great help from the KI team on that. So we actually on last week gave out a follow-up questionnaire. The initial questionnaire that we had given the team was last September, so it was quite a long time away in terms of morale within the team. So we are only waiting on one more coming back. One more questionnaire being completed, but we've already had a look at them, and of the ones that have come back, well, there's 10 responses, but there's people off maternity that didn't have completed. But the results are already looking more positive. I have to say 90% agreed that the addition of our wellbeing activities had improved staff morale, and 100% of the responses said that they were keen to continue those activities and incorporate more into our work. So that's really positive. And I have to say, anytime there is an activity that we have devised, there's great uptake from the team, and other teams within the building have commented on how much happier our team appears. So we're keen to keep the momentum and the motivation going within the team, and to then continue to look at our results and to give out the questionnaires to see, can we sustain that, and then address how is it impacting on our patients. And as I say, hopefully when staff turnover decreased, and it certainly has decreased, then it has a positive impact on our children. So moving forward, Karen, do you want to discuss moving forward?
So moving forward then, International Day of Happiness is now happening next week, so we're hopefully going to plan a lunch for the whole building, and that should incorporate as well International Women's Day, because we are a mostly women only department. There's a couple of men now, so they're willing to take part in our events as well, which is great. Another thing we're hoping to do is have a suggestions jar for team building activities, so that then if we feel like morale's getting low, we can take a suggestion out of the jar and try to incorporate that into our week. As I had said before, they're hoping to run another Couch to 5K this time, so maybe some of the previous runners will up their mileage from 5K to 10, and then Get Fit for Summer, another the kind of weight loss challenge, or get fit. And then, as Kate had mentioned, because they had won the volleyball competition last year,
Thrashed them,
sorry. They are going to be hosting this year, so preparations will be underway for another competition in the summertime. So there's lots of activities in the pipeline, and we always look forward to whoever has in store.
So that's just our little quote: if you want to go fast, go alone, and if you want to go far, go together. So appreciate you all listening, and we acknowledge that not everyone comes into their work skipping and holding hands, but if we're addressing some of the small issues that can make someone's day a bit better, then that's great. And as I said, it's all about trying to improve productivity within our team, and that we work well together. So if anyone has any questions.
So we've had one from Lynn Williams. She said, would you be able to share copies of the questions that you used in the staff questionnaire? And also, I was wondering, it would be great if you don't mind sharing the new questionnaire you've done, because I'm assuming were the questions a little bit different for that one?
Yeah, the first questionnaire we actually took from the IHI.
Yeah.
The Joy at Work, and then actually we gave it out, and when we looked at the results, actually there was things we would have liked to have changed in it in hindsight, and one of those things was the answers was agree, disagree, neither, and we would have taken out neither, because a lot of people had selected that, so we would have taken that out.
So I suppose that's what we've done in the follow-up questionnaire. We haven't given that option for people to select neither.
And in the follow-up questionnaire, we've addressed the themes that came out of the original questionnaire and focused on those, just to give ourselves some better data. Yeah, but we can share it. Yes, absolutely.
That'd be brilliant. And yeah, I didn't know it was International Day of Happiness on the 20th of March. So
there you are.
top tip for that. One of the questions I had was around how much time does it take to coordinate this? For other people maybe thinking of implementing this kind of approach and taking some of the learning from the session today, what sort of time commitment is it? And is it the four of you do that collectively? Just any advice you can give on that would be great.
Yes, so we started this, I suppose we handed out our first questionnaire in September time, but prior to that, we come together collectively. We try to arrange an hour or an hour and a half meeting, probably once a month maybe, was what it took, and you just have to be very productive in that time and know what you want to get done. So I'd say it was only a month prior to that we devised the questionnaire and sent it out, and then I suppose the activities themselves take a while to organise and get set up, but we do meet regularly, and it's not too time consuming. You know, when you have 3-4 heads together coming up with ideas, it's great.
Brilliant. So there's some that's really helpful. I think for people wanting to take it forward, time is always a concern, isn't it? So in the chat box, Ronan is responding, which is brilliant, to some of the questions around what was the question here? It's just jumped a little bit about how it will be applied in the acute setting. And he's responded to say, my background is also acute and I'd love to see this going forward. Do you have the same challenges with getting time to take things like join work forward? Gemma has responded to say time, size of the team, pressures of work and coronavirus at the minute, which is challenging, isn't it? So yes, I'll unmute Ronan actually.
Okay.
He's
I've got it. There we are. Hi. Hold on. I'll move. Hold on.
Sorry, Moon. He's actually here. He's away now.
I've been kicked out. Hold on. How's that?
That's great.
You got me now?
Yes.
There we go.
I was just wondering if you wanted to talk through some things you were just responding to in the chat box.
So the guys with IHI CAMHS have been brilliant, and I think the one thing that I've seen, we've been doing a wee bit of or trying to assist other teams with joy and work across the trust, and one of the challenges that I've seen is what the likes of Gemma has been saying. It's time, it's work pressures and things like that. But what Alana and the crew have been talking about is that you need to have a motivation for it. So it really does take a number of people in one area, where this is developing intrinsically within a team. So I've tried to move in and encourage other teams to try and take on board some of the IHI framework, the joy and work stuff, but it doesn't necessarily take hold. And when you find someone who has a need for it and a want for it, and has a group of like-minded individuals like Karen and Alana and Kate, they've been able to drive this forward. So I would encourage anyone who has interest in taking this forward, especially in the acute setting. That's where my heart lies. It really requires multiple people, because one person cannot do this alone. And you really need to develop a want for it and a feel for what your unique challenges are, and try and focus on that. Because no matter what Kate and the guys will share, it will still be down to each individual team to develop their own approach. Every group is unique, and how they approach joy and work will be unique, I think.
Yeah, I think it's testing out those change ideas, isn't it, to see what
yes.
what doesn't, and looking at how you can measure the impact of that, such as things like your questionnaire.
Yeah.
We've had a message.
Go.
Can anybody hear me?
Yes.
Can you hear me, Ronan? Oh, you
Yes.
can, way. No, I've just put up a message there. I work in Belfast Trust. So we have set up we have a senior leadership group consisting of senior leaders from all over different areas coming together, and we have developed like a joint driver diagram using quality improvement methodology to try and encourage joy in work to be developed across the whole of Belfast Trust. So we've started out with, it took us ages to look at the IHI framework and then break it down into something really simple. So we've kind of finally pulled together like posters on that and our driver diagram and what we want to achieve collectively. And then we had 6 teams that went through Joy in Work quality improvement training, where they developed their own driver diagram and change ideas. So they have their own measures in their own teams, but we have an agreed set of Joy in Work pulse survey metrics that we collect once a month from each of those teams. And we are now starting to plot that into run charts. And we've already got several data points from a lot of these teams. So I would be more than happy to share with you our pulse survey questions, driver diagrams, anything in relation to it. And yeah, they're staff in the Royal ED, intensive care unit, health and safety teams, labs teams, and they're all taking different approaches to how they're looking at joy in work, and then we're supporting them. So one example, when you talked about the pebbles in your shoes, so the labs team, when I went to work with them, they had done their What Matters to You conversation and had written everything down on Post-its, and then I asked them to try and theme them, and I helped them put this into a Pareto chart. So initially they were going to jump in and do their project on the environment. So they were going to look at, you know, painting their office and, you know, making a nice tea room area and all these things. But when we put the, themed it and put it into the Pareto chart, what the top header was actually civility in the workplace. And the second criteria down was environment. So they've now thought, right, we actually need to look at this again, because if they get the civility in the workplace right, then all the environmental issues and all of the other change ideas will be easier to implement. So I can share with you an example of some of the Pareto charts as well if you want. So it's, you know, so some of those teams are looking at those, some of those, you know, but again, we're all learning, and we wanted to bring on another 3 teams in April. That possibly will all be on hold now with the coronavirus. But in addition to that, we've also recognized as a group that not everybody wants to do this as a quality improvement project. So we're now looking at some of the quality improvement faculty, trying to get together to develop some kind of a joy in work program that mightn't necessarily be quality improvement, but will still have a lot of the principles of joy in work and the pulse surveys as metrics.
That sounds fantastic, John. And you know, there's some messages coming through on the chat box saying that people would like to see the resources. I've also sent you just now a private message to say, but I probably should have sent it to everyone, to say, would you be willing to do a Zoom call on your approach to the joy in work, building on the kind of session today?
Absolutely, yes. This is the first time I've used one of these Zoom calls, so you might need a bit of help with you to ask you how to set it up. But yes, absolutely. You know, I'd be more than willing to share. And I've also developed a bit of I'm developing a presentation at the moment for a Joy in Work meeting next week to try and bring together some of this information and it's in its draft form, but I don't mind sharing that with you as well. I really believe that we can all learn from each other, and you know, it's new, it's exciting, I'm very excited that it's something that's been embraced by our chief executive as one of our strategic directions going forward. So that means that everybody throughout the trust will be measured against this, which will be brilliant, you know. So hopefully it won't fall flat in its face because of the coronavirus, but we just have to remain hopeful that we can, you know, keep, you know, I sometimes think in times of the coronavirus and everything, all that camaraderie and connection to purpose and meaning, you know, is probably more important, you know. So some of the metrics might go on the wayside, but if we keep in touch with people, everybody so far that I've worked with in this process have found it really career changing, on a personal level and a professional level. So yeah,
Brilliant.
more than happy to share.
No, that's fantastic. So I will be in contact with you, John. But just
Okay, thanks.
to the team today, you know, you have done some fantastic stuff, and what you've come up with, and I think, as Ronan said, it was around tailoring it to your needs and what you think would work for you. And I think that is so important, isn't it, with this, in terms of not taking, so I suppose what part of the learning today is, you know, you've shared what you've done and the great achievements you've made, but as in true quality improvement style, you would, if someone else was looking to take that same approach, to test it and see whether there's an appetite for some of those areas within there. I was just going to say, if anyone has any other questions, could you type them into the chat box quickly? I also thought I might just unmute people, just quickly, to see if anyone has any questions they would, if they're not used to using the chat box. Here we go. I think I've unmuted. Oh no, not quite everybody. It's great that so many of you have been able to join today, because of an awful lot going on. So I think I've unmuted everyone who I can. Questions they would like to ask. Yeah, everybody. So, if you haven't got any further questions, I would just like to end this session. I'm just muting back everybody, so just bear with me. I would just like to end this session by saying thank you ever so much. It's great. There's some great ideas of things I'm thinking of taking forward, so that's fantastic. And thank you very much for taking the time today. It's been great hearing from all of you. Alana, Peyton, it's been fantastic. So, if we haven't got any, oh, someone's put in the chat box, which is lovely, really thought-provoking. That's how the presentation's been today, so brilliant. Thank you very much. I think if we've got no further questions, we'll bring this to an end. I will be in contact with everybody on the call, a link to the recording, and hopefully all the resources, which will be sent through, to make sure we can get them. So thank you all. Thanks again very much to the team. I'll see you all on the joint work call as soon as it's arranged. Yay!
Thank you.
Bye.
Thanks everyone.
Bye.
Bye.